It's my pleasure to introduce this panel, PowerUp in the St. Croix Valley, which is straddles Minnesota and Wisconsin. Sue Hedlund, who recently retired as the Deputy Director of the Washington County Department of Public Health and Environment in Stillwater, Minnesota, will be the first speaker, followed by Marna Canterbury, who is the Director of Community Health at Lakeview Health Foundation and brings more than 25 years of experience in community health leadership, nutrition programs, and health message design to her leadership role with the Lakeview Health Foundation, part of the HealthPartners family of care in Minneapolis, Minnesota. Donna Zimmerman is going to be part of the discussion, which unfortunately will be somewhat foreshortened. But she is the Senior Vice President of Government and Community Relations for HealthPartners Incorporated, a nonprofit, consumer-governed healthcare organization in Bloomington, Minnesota. So, Sue.
Well, thank you so much, and Marna, Donna, and I really appreciate this opportunity to share with you the story of a power of a community and what a community is doing in our area. And this is where we live and work, and so we care a lot about this community. But thank you for this opportunity, and we are also learning a lot from all of the rest of the presenters. So let me first tell you about PowerUp. PowerUp is a long-term and community-wide initiative that is happening in our community that has a vision to make better eating and physical activity easy, fun, and popular so that all of our youth can reach their full potential. So I want to focus, I hope today you get a sense of this is fun, and this collaborative work is fun, and it seems kind of arduous, but we really are having a very great time. The lead organizations for this effort are Lakeview Health Foundation and HealthPartners. And as we started this process back in 2011, we started planning for this initiative, and we recently just launched it in early 2013. So we're very excited about that. Oops, need to go back here a minute. So where are we? When we talk about the St. Croix Valley region, this is an area that is located 25 miles east of the Minneapolis-St. Paul metropolitan area. It's very scenic and historic, and it's considered suburban and a rural area along the St. Croix River. The St. Croix River defines the boundary between Minnesota and Wisconsin, and that's an important thing that we have. But we're also working, along with working in those two states, we're also working in 2 different counties, 12 towns, and 5 school district areas. To get an idea of how large this population is, we looked at there's 22,000 households in this area that have children ages 3 to 13. So that's really our target group that we've been working with. So that's kind of what we hope to make our spread and who we want to reach. So even though the lead organizations are those healthcare providers, PowerUp is not about medical care. Instead, we are using really a public health approach and use the determinants of health model to help guide our work. Our efforts are focused on improving health behaviors, addressing social and economic barriers to health, and changing our environment. This framework guides our decision-making and setting our priorities, choosing interventions, and seeking out partners who share our vision. Obesity has also been identified as a top health priority for our region through recent hospital and local public health community needs assessments. So we really firmly believe to address that issue, we need our strong cross-sector collaborations and really work on this as a collaborative approach. So we are committed to working in our community and with our community as partners, and this really requires us to have real relationships with real people and quite a variety of those. So let me tell you how we got started. In early 2011, a new affiliation was established between Lakeview Health and HealthPartners. So both parties made a financial and organizational commitment to improving the health of the communities served by Lakeview Health, which is based in the Stillwater area, Minnesota. The real unique aspect of this approach was the what and how to improve health was not done by those funders or executives sitting in office in a different community. The decision was really delegated to people in the community. This easily, I could be talking, if it hadn't gone, obesity was not directed as starting as an obesity prevention project. It was started as, what do you in a community, how do we improve the health of that community? What are the needs? And the community people get to decide what that is. And that was really, truly a gift to us. So to get that to happen, this work was then delegated to the Lakeview Health Foundation board. And I was at the time a member of that board and working at the local health department, and I was asked to be a partner and advisor in setting this new direction. So together with foundation staff, we formed a health and wellness committee, which included several of the foundation board members, and also we added additional community people, and they all were very concerned and caring people about their community. The majority are not health experts or professionals in this area, but all we know, they work in the community, they love their community, they want to make a difference, and that's who joined on to this effort. But I also want to point out in this chart at the bottom the importance of the partnerships with our local health departments that have really been supportive of this effort. They really are a good foundational partner in this effort because they also share our mission of improving the health of our communities. They brought expertise in really knowing the community, knowing how to do community engagement, and also obesity prevention strategies, including policy development and making those changing environments. So that has been very important to our success in having them involved. So we started meeting in May of 2011, and together we learned about local health issues and identified gaps in addressing those issues. And by September, we had decided that preventing childhood obesity would be our priority, and we then expanded our committee membership to include some school representatives, a pediatrician, a nutritionist, to help us really some specialized expertise to help us along this way. Then we started actually adding more staff. In 2012, we finalized what at the time, we were calling it whoa, this really goes. Hold on a minute.
Yeah, you still have
it. Okay, I'm done. Thank you very much. Okay, regroup. Okay, now we're on it. I just lost a minute of my time. See, we have fun. That's the whole deal. By early 2012, what we were calling this was a children's health initiative. And we weren't talking about obesity at all at that time. But in order to really now move it forward, we felt that we really need some help, and we needed to have some actually adding additional paid staff full-time to help work with our community group and help to launch this. So we hired a full-time director, and then we continued on with getting a name and a logo and branding this initiative. And that was when PowerUp was born, and that, you'll see that in our logos and our Chomp character later. There are many people in the community who wanted to get involved in that initiative, so we adopted a flexible committee and governance structure to accommodate the growth and get our communications activities and intervention strategies to work. So actually, the Health and Wellness Advisory Committee started to shift its focus as we set up a PowerUp steering committee, and different work groups started at that time to get things launched. And so we kind of changing some roles at that point. So in May 2013, we were ready to officially launch PowerUp. So yes, this took 2 years of planning in the community. So really, the community didn't know much about it. We were working and we were gathering partners and talking to people individually to get people engaged, but it really took us about 2 years. But we launched it in May of 2013 with a real community event. And when we saw the enthusiasm of the community and the response from kids and parents, it was really, we knew we were on the right track at that point, and very happy with our planning process. Now this year we're adding 2 additional communities in Wisconsin. They are Hudson and New Richmond, and we're doing that in partnership with 2 other hospitals that are affiliated with HealthPartners. And together we're going to have truly a valley-wide area. And this is also leading to more partners and more people to be involved and needing to use some different strategies that are very specific to each of those communities, because even though we're all in this region of the St. Croix Valley, each community is unique and different. So let me tell you about our stakeholders in the sectors that we have involved. Currently, we have in PowerUp involved about 130 what we call community advisors, and those are both individual people and organizations. Through using committees, work groups, and individual input, the number of advisors continues to grow. And advisors help lead and guide the effort, support our strategy development, and set priorities, and really hold us all accountable for results and how we measure that. Along with living and working in our area, our advisors share an incredible passion for the well-being of all kids and in their communities. These volunteers are also key agents for change as they create to do what is best for kids in their areas of influence And we have about 13 sectors represented, and they include, for example, healthcare and local health departments, but school district administration, early childhood programs, businesses, nonprofit organizations who are serving youth, food shelves, civic groups, and faith community. Our partnership approach is not about finding someone just to fill the slot for a certain sector. We look for people who are committed to our vision, and we also connect with people who have a particular expertise that we need, such as a local food marketing expert, who comes in pretty handy, early childhood educators, and even our own healthcare providers. But most importantly, many of our stakeholders are parents and kids, and they're the ones we really need to listen to because they're the ones telling us what the real life experience is and what really happens. So let me tell you about this fun family. This is the Leonard family. Jim is a foundation board member, and he could be described as a business sector representative to PowerUp. He owns a local car dealership and certainly knows about running a business. But more importantly, Jim and his wife, Mandy, care about their children and the community they are growing up in. And they want to create community change so that their daughters and their friends and classmates and neighbors grow up and reach their full potential. Mandy and Jim are tireless volunteers for PowerUp. Mandy worked with the PTA, the Parent Teacher Association, to power up their entire school carnival. No donuts, no candy, just fruits, veggies, and a whole lot of fun for kids and adults. When Jim saw the ice rink in his outdoor ice rink in his community needed ongoing maintenance to keep it available for kids, and ice rinks in Minnesota are very important, just want to point that out, he acquired a Zamboni machine and took on the job of maintaining that ice rink. In addition, he wanted to add the PowerUp logo to the Zamboni to show his commitment to our work to the rest of the community. These are examples of how the importance of community involvement, leadership, and advocacy for change are making the biggest differences in our communities. So what have we learned? We talked a lot about leadership today. Our communities are making this happen with a wide variety of stakeholders who are really bringing innovative ideas, expertise, and they also have a lot of different connections and a lot of different relationships that keep emerging to us every day. And this really builds a solid platform to us to build upon. And this initiative, though, needs to have a strong collaborative lead organization to hold everyone true to the vision and message. Both Lakeview Health and HealthPartners have a value of collaboration just kind of built within their DNAs as organizations, and it is very real. They are here in our community, they're staying in our community, and that is really important. They have demonstrated that they are not in this for the short-term market gain, but are committed to us to improving the health of our community. Even though they have a large financial stake in this initiative, they are allowing us in the community to do the work and yet continually provide value support, guidance, and expertise to the partners. Together, we are sharing leadership, decision-making, and recognition, and not only at the start of the initiative, but throughout as we implement the whole process. But also, I want to point out, having dedicated staff have been critical to the process we have made so far. Staff provide expertise in community health improvement, partnership development, and evaluation, and then they help us move things forward by convening and listening to our advisors, facilitating consensus, and building community relationships, but they also provide us an ongoing framework. Marna, our Director of Community Health and our first employee, will now describe the operating framework for PowerUp, as well as share examples and lessons from partnerships and measuring results of this initiative.
Well, thanks so much, Sue. As you can see, we really are so lucky to have her as such an energetic and committed community volunteer who serves tireless hours on this initiative well before I ever joined the team. I think that Sue is just such a great example of this, and there's many others. And as we go into framework and some of the examples, just to keep in mind that they're always at the table. And as the director of the initiative, I always know that our work is so much better because it's informed by people who bring an expertise, who bring a perspective that makes the work real in our community. At the same time, I am a member of the community that we're serving, and I think that is a really huge advantage. I'm also a parent, and so I come at this, it's my job, but I also come at this, as do all our advisors, with a passion for the kids in the community and understanding that if we don't make a change, the results are just not acceptable. As we work forward with our models, we needed to move forward with a framework to help guide our work. And this is described in detail in a handout in the back of your brochure, but I'm just going to give you a little very brief overview. PowerUp is within the community. I think Sue made that abundantly clear. All our work is informed by it, advised by it, and priorities are set in consultation with these key advisors. In addition, the PowerUp framework is a multi-level framework. And what's been important is while it's informed by many other theoretical models, this is not an academic exercise. These words and these terms that we choose are chosen by our committee in a way that everyone understands it. So the banker, the car dealer, the parent, the food shelf director, that we all can speak the same language. So we work at multiple levels. We describe them at the top as changing the environment, the food and physical activity environment, engaging the community, one of our most important places we've been acting in the last couple years in particular. Programs to change individual behavior, and of course recognizing the important role of clinic systems in all of this work in identifying and helping higher risk individuals. What's also extremely important is those little green zones in between the levels. We call them the engage and transform zones. Those really reflect how dynamic this process is. It's not linear. Many have said that today. I've heard the word messy used for some of this work. I think that's true. One of my colleagues also says, well, Marna, some of your best work is done when you're drinking a lot of coffee with other people. And I think that's a really good description. What that means is sitting down and talking about what we do together, sitting about in shared community. And that's happening in those green zones. What's also important is that activity is simultaneously happening at all levels of the initiative at the same time. And I've heard somebody use the word chaos for that earlier. I'll just call it really, really energizing. But we know it's important. We know that just working with one sector at one level won't get us where we need to go, and we know we need to get there. The other most important piece I think about this model is the change that happens that you can't illustrate in a framework, and that is the contagious change that happens. So when you have, for example, a school board member who's advocating for change within the school, who also happens to own a local restaurant and decides to open without serving any sugar-sweetened beverages, that's a big deal. It also shows those interrelationships of roles that people have outside of what sector they may or may not represent. Each partner brings great strengths to this work, each advisor a unique perspective. One of the strengths that our lead organization, Lakeview and HealthPartners, brings is communications. And this has been critical for us to be able to especially make progress in the zone of community engagement. It's tied to the community's vision for change, however. The charge of the community was really to make sure this was positive and fun. Didn't want to be the finger waggers, didn't want to be giving should messages. They wanted it to be fun and engaging. And so these communications objectives you can see laid out in graphics throughout, and you've probably noticed the carrot now down in the corner. He has a name. His name is Chomp, and he was named by the community. This superhero, as we call him, has more influence than we ever would have anticipated. Children love him, they hug him, they write him letters. They wave at him if you happen to be out with him, and we have to guard his identity very carefully. Again, while it looks like a great marketing, and it is a great marketing tool, the reality is this character brings kids in, and it brings them in right in a positive way. So we're grateful to have that. The PowerUp countdown messages are also illustrated there, and they are consistent with national messages of 5210. We just put our own local spin on it, but didn't want to contradict the other important messages that we're all trying to put out throughout the country. The real work, however, is happening in partnerships, and I'm only going to highlight just a few in the time we have. Whether we're working with a local health department or the local restaurant, which I mentioned, or early childhood centers, or cooking schools, and even our own hospital cafeteria, change is happening. A key partnership, however, that I think best embodies this work is open gyms. As Sue mentioned, ice rinks are important, and the reason that that's important is it's cold, and it's also very dark in Minnesota and Wisconsin for many months of the year. That really has created something that we've identified as being an issue because our parents tell us it's an issue. Where am I to go for a free or low-cost place to be active with my children? when it either is too cold or unsafe to do so. It's like an exercise desert, really. We talk a lot about food deserts. We describe this community as rural and somewhat suburban. There is no public transportation. Once a child in a family gets home for the evening, it would be a burden to get back in a car and drive a long distance to somewhere. However, local schools and community centers have a wealth of gyms and pools. We have been able to partner with them, not through a granting relationship, but through a partnership where we sat down and said, how do we get these spaces open, and what can we do to help you with that? And we figured it out. We started out in the Stillwater School District, the place where we started most, but this year, 5 communities through school districts or their community centers will be opening up open gyms weekly. They are almost always free, occasionally low cost. We've had up to 120 people come on one given evening, and parents are telling us how important it is. Again, changing that environment, but we couldn't do it without partnering with others. While PowerUp is not a school-based initiative, we all recognize that schools are critical to any progress we're going to make. And I think something to point out about schools is that they're more than the school administration and the school board. They are very important, and we have strong relationships there. But never underestimate the power of a parent advocate, a thought leader at their PTA, who really can make all the difference in whether a school changes. I have so many examples of these parents who have gone to bat and said, I want exercise balls in my kid's classroom. I was just at a PowerUp meeting, or whatever it is that they do. They advocate for change at the athletic booster clubs and the concessions that are served. They're advocating for change all over. They're very influential in the traditional methods of reaching. Schools may not include them unless we're intentional about it. So while we recognize we do and we connect all the time with our key partners in districts, we don't want to leave the parents out of it. The last partnership I want to highlight is one that's really close to my heart. It's a project we have done and a partnership we have with our local food shelf, Valley Outreach. This started under a mutual goal to say, what could we do to have a better shelf for better health? The food shelf came to us because we already had a relationship with them, and there were some external granting opportunities that we had available to us. That being said, we started to work together, and this is reaching more than 400 family households a month. 80% of the clients served by Valley Outreach do have children in the home. So this is very much reaching the high-risk group of folks that we want to make sure that we reach in an equitable way. Before the partnership, this was a wonderful food shelf, dedicated people, client-centered, and extremely compassionate. The arrangements, however, at most food shelves, if you know anything about them, are just based on kind of past history. Well, this is how we've done it. They haven't had a partner at the table to help find new ways to increase the healthful foods that are available. So as we worked with Valley Outreach, what we discovered is that there were a lot of opportunities, but we did all this work together. We didn't really have a model on how we could rearrange this, so I'm just going to show you. This is before, bright, clean, a generous community keeps it fairly well stocked. But after the PowerUp partnership, a few key changes. First of all, frozen vegetables. We insisted that we figure out a way to have vegetables available in more forms than just canned and fresh. They were able to get that through another grant. Produce is arranged in a different way. You can see it in bright baskets that we got at a dollar store, just to improve how they look. The shelves are stocked and there's more shelf space available for fruits and vegetables. In addition, the walls got painted by volunteers and so did the shelves. They got rearranged in a different order. We talked to a local grocer who told us how to improve the flow through the food shelf and made a big difference. But really the magic of this is not in the signs or the pretty graphics. The magic is really in the lists. In a choice model food shelf, a client is provided with a list from which they can choose the foods to help feed their family. This is the original list. If you'll notice the first 3 ingredients, we've got pancake mix, pancake syrup, baking oil. That wasn't intentional, it was just there. Afterwards, we completely restructured the order of everything. The lists now start with fruits and vegetables and less processed foods. It's making a huge difference. You can see this drives inventory and all other kind of considerations, which we are addressing with donors, with food banks, and with others who are in the supply chain for this. This is important. think I've mentioned that, but this is a slide that shows that we have the vast majority of the clients and families served at Valley Outreach want to eat better, but almost 90% get more than half of the fruits and vegetables for their household for the whole month from the food shelf. We were surprised by this. We know we have more work to do because of its importance. So what have we learned? Each partner brings something unique to the table. All this work takes time. To do it authentically, you need to be on a first-name basis. It's not through email and sending out a brochure. Practical meaningful evaluation is needed. I'm going to talk about valuation very briefly. We measure in 2 levels with PowerUp. One is that we measure what we're doing, which all of us can do. Count it up, how much are you reaching? But it is important to do this on an ongoing basis so we can see whether we're having, for example, this graph is outreach efforts. We do this with partnerships and others as well. So you can see over time, those are quarterly graphs to make sure that we're having the right mix and amount of activity. More importantly, what difference is this making? We do rely on external surveys, surveillance data that we will be monitoring over time. We've also noticed, we also identified a gap in the data of what were the behaviors of younger children and their parents. So we developed our own survey. We're getting great results back. Our baseline was in January of 2014. And we are looking at awareness, but also behaviors of children through their parents' eyes, as well as parent supporting behaviors. But really importantly, and not to be missed, or sometimes we miss the importance of the stories. I know it's qualitative, but the things I hear from people and our partners hear from people and the stories they just spontaneously call up and say, or the little letters to Chomp from the kids, say a lot more than most of my graphs. I think what's important about these stories is the gratitude that people have for somebody taking the lead and taking action, and then they invariably say, how can I get involved? And that's what grows, as Sue said, the involvement. At the end of the day, our calling card to the community is we power up in the St. Croix Valley. It's not a command, it's an invitation. It's just saying we're going to do things differently now. There's a quote, and if someone can tell me who it's by later, please help me, but there's a quote that says, keep telling the new stories until the old stories die. And that's what we're trying to do here. The St. Croix Valley is a different place. We do what's best for kids. How would you like to join in our effort? Thanks much.
Thank you. Just to share with you where we're going to go. We're going to have 10 minutes for questions. Then we're going to have a 5-minute activity break directed by Jim Salas. So those of you who need bio breaks, take them in between those times. Please ask questions. Go to the mics to ask questions. But as you're doing so, let me begin with a question that I think is best directed to Marna and Donna. And that is, this initiative began with support with foundation support. What assurance is there that this initiative will be sustained? And does it depend on that ongoing foundation support?
It's a great question. I think when we went into it, we said we're here for, at least 10 years. Now, as a health plan and a care delivery system in that community, we're going to be there for a long time, and we are going to want to make an impact over a long time. So I think we wanted to offer the reassurances that we think this is a 10-year effort minimally, and we're quite confident that that effort will be sustained, not just by ourselves, but potentially other partners. But it was important to make the long-term commitment at the outset.
If I can add to that, Bill, what Donna said, I know when I'm out working with partners, the assumption is we're here for 2 to 3 years because that's past experience, and that what we're going to do is write grants, and neither of those are true. And once we get through those 2 factors, it really changes the dynamic of the conversation. Back to, so what can we do together? What parts do you bring to this partnership? Here's what we bring. Better ideas, better work happens. If we said, hey, we have 2 years of funding, I think the conversation would be very different. So we're very grateful that we have that longer time horizon.
I think we also felt, just one more thing to add to, our local school district just got a multi-million-dollar grant to provide additional activities and support inside the school district. And we view our partnership with them as probably enabling them to get that large grant, and we're thrilled. It brings more dollars to the table. It doesn't matter if those are flowing through HealthPartners or Lakeview Health Foundation. It's really just important that it's aligned and it actually makes PowerUp bigger and the reach broader.
But I think from a local person, the whole 10-year commitment proposal was pretty skeptical. It's like, nobody ever does that. And so, but it was very empowering for the community, and the energy level just changed and said, oh, we really can do something. Because they knew how complex this is and all the work that had to be done, that there's really organizations that were going to commit to this was really fantastic and, again, empowering to us.
And the other question is about your metrics, which are clearly there. Could you describe in a little more detail how those evolved and what you do with them when you have them? And I noticed that even though this is an obesity-focused initiative, BMI is not one of your outcome measures, at least not yet. And how did you bridge that expectation?
As I think many people have eloquently described today, we need to really look at those midterm measures about what behaviors are changing. And we do know from the evidence that changing behaviors in children and family can and should result in changes in BMI, but those behavior changes are going to happen first. And even before that are the environmental changes that make that possible. So we have, and the measuring over time is really important. You saw that in the graph. So we do the same with how much time we're investing in partnership development, how many policies and practices and environments are changing, as well as looking at behavior change primarily through our survey tools. Those are going to be important. Long term, we will look at BMI. I think that dose conversation we had earlier today is really important about what expectations we can set about that change. We still need to discover. But we are pointing the community, and we are working together to point the community in the direction that will get us there.
I think, too, that we all understand that it's difficult to measure culture change, which is really what we're trying to achieve. And so one of the really great early wins was, Marna reporting that the Stillwater School Board had adopted a wellness statement for students. Simple, but it sets the stage for students to be healthy over the long run. So I think that got us thinking about, it's very legitimate for us to be focused on policy supports and environmental change as being real outcomes for this initiative that set the stage for long-term population health improvement.
Just a final question. One of the things that has been implicit in some of the discussions today and I think clearly characterizes what's going on in the St. Croix Valley is the power of social capital. And I was thinking about whether that social capital is indigenous to Minnesota and Wisconsin as opposed to Washington, D.C. or other venues, or whether this program actually builds that social capital. And I wonder if you could comment. I mean, are people in Minnesota and Wisconsin just nicer and more committed?
Well, there is a joke that goes around in Minnesota. It's Minnesota's home of 10,000 collaborations. It is somewhat of our nature. I mean, we have a very strong healthcare system, a public health system that is built on partnerships across the state. And also we have a very vibrant nonprofit community that really works together. And so in a bit, it is part of our DNA a little bit that we do that, because that's how the communities work. But still, you have to still provide opportunities for people to get engaged. And so creating these opportunities in whatever way they can, you have to meet people where they're at. If you can just do it as an individual, show up and help us on something, that's great. We welcome that. If you want to be part of a committee, we got one for you too. We'll try to fit you into that group. So we want to, social capital, you need to meet people where they're at and give them those opportunities on what they can do, because that will grow, and they tell their friend, and they tell their friend in those commercials, and they'll tell another friend. That's really how it happens.
I think, too, on the partnership, Sue's right that we have a really good culture of partnership in the community, but it's also important, I think, from the perspective of one of the lead partners, that we're willing to give up some of that control and cede that to the group. So, Chomp isn't wearing a big HealthPartners logo on his back. And we feel that it's really important that if we're going to take partnerships seriously as a way to reduce socioeconomic disparities or improve the environment, we need to give up control and some of the kind of maybe more personal company recognition that goes along with it.
Well, please join me in thanking this panel. And I'm going to now introduce Annalie Ramirez, who's a planning committee member and a member of the Roundtable, the director of Salute America, who will facilitate the last case study presentation and discussion, the Sault Ste. Marie tribe of the Chippewa Indians, a tribal example of cross-sectoral work. But before that, before she comes up and before the next panel, Jim Salas is going to give us an activity break, much needed.